Sure. ONC, Office of the National Coordinator for Health IT, is a part of HHS, and we're basically responsible for trying to get electronic medical records, electronic health records interoperable right now. In 2016, Congress passed almost unanimously the 21st Century Cures Act. President Obama signed it into law. The current administration is totally behind it. And two of the main parts of that law are interoperability of health records, as well as the ability for patients to access their medical records. And really access their medical records at no cost using a smartphone app. So that's really what we're charged with doing. That's our main responsibility now. And just for a little perspective, I went to work for a large healthcare organization in 2004 as one of the implementation managers for electronic health records. Mm-hmm. And at the time, paper records were just strewn all over the place. In physicians' offices, you had piles of electronic medical records. So it was really groundbreaking when we went to electronic medical records. My healthcare organization was vertically integrated, meaning that everything was under the same roof. The doctors were employees, the hospitals belonged to the organization. So it really was, it was totally integrated and interoperable. If you went into the emergency room, they could look up your information, they could see what meds you were taking, what your chronic conditions were, and so forth. But right now, although 97% of hospitals and approximately 80% of outpatient medical offices are on some form of electronic health records, they don't necessarily talk to one another. Yeah. So that's the challenge moving forward, and that's what we're working on.
And I think